Now we move on to this morning's session, and can I welcome Katherine Devlin from the Electronic Cigarettes Industry Trade Association and Tom Pruen from the same association.
Good morning.
Good morning, and can I thank you for the written evidence you provided to the committee. And obviously the intention of this session is to explore some of that information a little bit further, to try and extract some views and opinions and perhaps evidence that supports one way or the other the proposals in the bill. And if we go straight into questions, and I'll start off with Gwyn Price.
Thank you, Chair. Good morning, both. Smokers are well accustomed to being unable to smoke inside public places and workplaces. Why did being able to use e-cigarettes indoors be likely to encourage more smokers to quit, in your opinion? And what evidence is there to support this?
In terms of evidence, possibly the Industry Trade Association is not the best organisation to speak to. There are some consumer organisations who I'm sure would be able to give you a more thorough answer on that one. But certainly in terms of the benefits that electronic cigarettes can provide, they're all dependent on their ability to appeal to smokers as a better alternative to smoking, whether that be for financial, health or ease of use reasons. It all adds to the appeal of them to people who, in many cases, are reluctant to quit or unable to quit. So it's very much a case of the appeal to consumers is what makes electronic cigarettes have such potential. And anything that detracts from that, obviously, will then deter some smokers. And in terms of where they're used, if you're in your local pub with your normal group of friends, if you're a smoker and you have to go outside, you're then sort of somewhat outcast. Whereas if your friends are sat around the table with their electronic cigarettes, indoors, out of the weather, particularly as winter's approaching and it gets to be quite uncomfortable outdoors quite frequently, it's then another tool that effectively uses peer pressure to convince people to use the products, whereas otherwise that wouldn't really exist. If they go outside with the smokers, then it's all the same.
Thank you.
Alan?
I've read your evidence through a number of different articles and pieces of work on the subject. I remain entirely and completely unconvinced by your arguments. To me, the ban on smoking in enclosed areas was and has been a complete success in terms of what it's seeking to achieve. And intuitively, if you're smoking an e-cigarette, you are smoking. Accept the arguments that you're going to make. But you are, and you are normalising an activity which is probably the biggest killer in Wales today. My feeling is that the government's position here in terms of treating e-cigarettes and nicotine cigarettes as being a similar sort of activity is entirely a fair proposition and proposal to make. And at a time, I represent Blaenau Gwent and I see the impact of high rates of smoking in my life. And it appears to me that we want to remove the action of smoking as a part of a normal everyday activity, whether it's social or not. And what the government's proposing is not a draconian thing, but banning e-cigarettes, as some of your literature has said. It's actually bringing e-cigarettes into line with what we do with tobacco. And that, to me, seems an entirely reasonable and fair proposition to make.
I would, with respect, disagree with you on a number of points there.
I anticipated you might, actually.
First of all, using an electronic cigarette is not smoking, although it generates
So what is it then?
It's generally referred to as vaping on the same logic. If you set something on fire and breathe in the smoke, we refer to it as smoking. If you activate an electronic cigarette and breathe in the vapour, we refer to it as vaping. And although they are visually similar, in terms of chemical composition, they are completely, utterly worlds apart. And secondly, in terms of normalisation, I don't think that the use of electronic cigarettes can normalise smoking, in large part because smoke has a very distinctive and quite unpleasant smell. And the vapour from electronic cigarettes doesn't. It also doesn't stain walls, fingertips, and have a lingering smell. So they are quite distinct. And the use of electronic cigarettes indoors might normalise the use of electronic cigarettes. But if that increases the chance of people switching to them from smoking, is that a bad thing? Because, as you quite rightly pointed out, it's the smoking that kills. So if we normalise the use of electronic cigarettes, bearing in mind that despite the efforts of everyone in tobacco control and public health, between 20 and 25% of the population still smoke. So it's actually still quite normal. The proportion of the population who use electronic cigarettes is quite small. So in effect, it's more normal to smoke than it is to use an electronic cigarette. So normalising the use of electronic cigarettes potentially actually has quite considerable health benefits.
I've read these arguments. I just don't find them convincing, I'm afraid. You know, at the end of the day, I appreciate the points that you're making, but I think you're making very narrow points, if you don't mind me saying so. And I'm trying to make a much broader and wider point about the place of the activity of smoking in our society and the action of holding a electronic cigarette, breathing in, vaping, or whatever you call it. I've never heard anybody outside these walls call it that, by the way. And then exhaling the rest of it, is designed in order to mimic smoking, I would argue. Absolutely designed to do that. And by designing it for that purpose in that way, and allowing that activity to take place in a place where we wouldn't allow tobacco to be smoked, we are renormalising the cultural acceptance of smoking as a reasonable activity.
Again, I would respectfully disagree on the basis that even to people who vape electronic cigarettes, the smell and presence of second-hand smoke is generally quite offensive. So there are a group of people who've converted from a dangerous activity to a safe one, who are effectively then becoming more hostile to the activity they switched from. So if anything, it doesn't renormalise smoking, it denormalises it even further on that basis.
I presume you provide us with the evidence for your use of the word safe. It's quite a profound word.
Relatively safe would be a more precise.
So you're going to qualify it now?
Yeah.
Okay, well, you've sparked off some interested parties now. I've got questions from Altaf, then Lindsay, then Ellen and Darren.
Yes, I wanted to come really what Alan has described. What is smoking? And when we say cigarette smoking, why don't we say smoking e-cigarettes? And what is hookah and what is shisha? Are they same vaporized, smokes?
I appreciate you represent the electronic industry and therefore not necessarily some of the other products.
It's broadly, when we refer to smoking, what we refer to is igniting something so that it burns. And in the case of tobacco products, rather than smoked food, then inhaling the smoke. And the smoke is made of the particles and the products of combustion. So smoke is made of small solid lumps and various liquid chemicals generated by breaking down the material that's set on fire into all kinds of strange, weird and wonderful chemical compounds. And it's broadly the same whether it's tobacco, shisha, or anything, in fact, that's set on fire. There is no real qualitative difference between marijuana smoke and tobacco smoke. Smoke is broadly smoke. And the same health risks, in fact, apply to third world countries where there's lots of cooking over open fires indoors, as from other kinds of smoke exposure like tobacco. Because broadly, smoke as a class of compound is pretty nasty. Whereas the vapour from electronic cigarettes is a solution heated until it turns basically into a gas. There's absolutely no combustion. There can be some minor heat breakdown products, but it's very low levels compared with smoke. There aren't particulates in the same way because the droplets are formed from condensed liquid, so they're liquid and not solid. And the chemical composition of smoke is heavy on things like polyaromatic hydrocarbons, which is your tar in cigarette smoke. And it's generally pretty carcinogenic, pretty nasty. And most of that is completely absent from electronic cigarette vapour because it's not produced by combustion.
Has it been a cause of a fire in any case?
I'm sorry?
Electronic cigarettes. Have they been a cause of fire?
There have been some incidents involving batteries which have resulted in fires. But that's specific to the battery technology rather than electronic cigarettes. We also get it with laptops and phones. But it's worth bearing in mind that one of the leading causes of house fires is still smoking articles, as the Fire Brigade refer to them. And I think it runs to something like 5,000 a year caused by tobacco and smoking articles. Whereas I think we're running at something like 2 a week for batteries. So again, there is a significant difference there in terms of safety.
Obviously, in that argument, could I just clarify one point? There's been reported that a lot of people actually don't stop smoking and take up e-cigarettes. It's a combination of the both. So there's still a likelihood that a lot of people will still smoke at home, whereas use e-cigarettes more perhaps in public places.
Yeah, I mean, there is definitely a certain level of people who use electronic cigarettes where they can't smoke and smoke where they can smoke. And according to ASH's statistics, it works out that basically for every 2 people who use both, there's 1 person who only vapes. Having said that, things like NRT are approved and recommended for cut down to quit because one of the predictors of successful quitting is reducing the number of cigarettes you smoke. And we would broadly expect the same pattern to apply to electronic cigarettes. Although equally, one of the things that's required to stop smoking is a certain level of willpower and desire to want to quit. And for some people, that just doesn't exist. And therefore, it would be unreasonable to expect that even if they cut down using e-cigs, they'll quit, because they just simply don't want to. On the other hand, these are also the people who are unlikely to quit by any other method. So it's not liable to make any sort of statistical difference in the long run. One of the big data sets on smoking rates is Robert West's smoking toolkit survey. And based on the data he has, he estimates that there's about an extra 20,000 non-smokers as a result of e-cig use. I can't really speak to his methodology, you'd have to ask him directly, but that's his estimate.
Okay, thank you.
Can I just add to that, Mr Chair? At any given point in time, if you assess the number of people who are solely smoking, solely vaping or dual using, you're always going to find a fair amount of dual use in the population of people who have just started vaping to try it out with a view to perhaps switching completely or for whatever other reason. So in those early stages for many smokers, they are still reliant on their cigarettes, their tobacco cigarettes. And so while they're trying out their vaping device, they'll also be continuing to smoke. So at any given time, you're likely to have a larger number necessarily of dual users than is necessarily reflective of what will end up being the numbers who are fully quit. But we do, as Tom said, have enough data now to be able, some of the statistics from ASH and Robert West's data that can plot this over a longer period of time, over several years now, and show that actually you do end up with, where you've got two dual users, you've also got one who has fully switched.
Lindsay?
Don't get too all doom and gloom, because I'm quite liking some of your evidence. I'm from a generation that grew up living in a smoke-filled home, and when I went out, as I got older, I went to smoke-filled pubs and clubs, and I think it's a much better environment now. We've banned smoking, and I have friends who no longer smoke 40 cigarettes a day. They're down to about 5, and they vape, as you say, and it is a well-known phrase, vaping. But I am concerned about the e-cigarette flavours. I only glance at the stalls and the supermarkets and shops, but could you explain to me all of these flavours? They sound as though they're designed to encourage younger people, the vanillas and the bubble gums. I quite like bubble gum, but vanilla sounds quite nice to me. And is that encouraging young people in your evidence from your society? Do you think people are taking this up, young people are taking this up, or are you still maintaining that people are vaping instead of this nicotine, horrible smell smoking? Because you can smell smokers. I can smell them a mile off. I can't smell a vapour at all, I'm afraid.
Well, there's nothing to be afraid of with that. But I think that the issue of flavours is a somewhat complicated one. One of the things that is generally assumed is that adults don't like flavours. But I think we can, by a brief poll perhaps, identify that that's completely fallacious. You know, adults like things that taste interesting. You know, it's not just the province of children. And one of the dramatic things about giving up smoking is that your sense of taste recovers. And obviously, once you can taste things, the last thing you want to taste is tobacco, because as flavours go, it doesn't actually have very much to recommend it. And at that point, you know, different things appeal to different people. Lots of people like a fruit-flavoured vape. It doesn't appeal to me in the slightest. But for some people, that's what they want as an alternative to smoking. They don't want something that tastes of smoke because it tastes moderately disgusting. And as a trade association, we've always maintained that these are adult products for adults who smoke. And our policy has always been that our members should not sell to anyone under 18, even if the products are nicotine-free. An electronic cigarette is an adult product. So our members have wide ranges of flavours, probably 150 in some cases, which have never been marketed to children. The flavour ranges are developed in response to requests from the people they sell to who are adults. Equally, you know, there is the potential for some of the flavours to potentially appeal to or be marketed to children. And we would take a very hostile view of that, as would the Advertising Standards Agency, and indeed everybody. You know, it's in no one's interests to create a new generation of nicotine addicts, be they smokers or not. But fortunately, you know, the evidence so far suggests that even before the mandated age limit comes in October, youth use, although experimentation is quite frequent, almost none of them go on to regular use, which is a very positive sign.
Okay, thank you. I'm just a comment really. I'm always horrified when I see a 10-year-old smoking. I'm puzzled when I see them vaping, and there's a hint of worry there. That's all. Thank you.
Ellen?
Yes, a major part of the argument for a ban on e-cigarettes in enclosed public places has been the fear of renormalisation of smoking. In your evidence, you say that electronic cigarettes are increasingly dissimilar to tobacco cigarettes, and that we've also heard evidence that enforcement of the ban on smoking in enclosed public spaces has become more difficult with the introduction of e-cigarettes, especially those that are similar looking to cigarettes. Can you tell us a little bit about what the industry is doing to make e-cigarettes less increasingly dissimilar to tobacco cigarettes? And then I also have another question, slightly different, and that's on the point of sale of electronic cigarettes. The concern that Lindsay has just raised in terms of making them an attractive product at point of sale, on counter, to young people in particular, and whether you have any views on point of sale of e-cigarettes being dealt with in the same way as e-cigarettes, and that is that they are hidden from public view and only requested.
Deal with the two questions separately, if it's okay yourselves. So,
Shall I just deal with the likeness to cigarettes? That's the one I use. Looks nothing like a cigarette.
Yeah, I know that there are those around, and then there are others.
The thing is that there is a significant shift away from what we call the first generation devices, which do look like a tobacco cigarette. They look very like a tobacco cigarette. But increasingly, those products have been found to be less effective. They don't perform terribly well. They're not actually terribly appealing to smokers who have made the switch. And so increasingly we're seeing people moving to, perhaps not all the way to the really big ones such as we use, but a sort of middle ground. But it definitely does not look like a tobacco cigarette, really, at all.
Do you have any evidence you could share with us in terms of the proportion of the industry
data
now?
that we've gathered it was in March that we last gathered the data directly from the industry sector. And at that point, it looked as if it was approximately a third of the market in the UK that was in just the cigarette type, the ones that look like a cigarette, with 2/3 being
But equally, that's
moved on.
broadly, the cigar-like form factor refers to something that the same dimensions as a cigarette. But even in those, quite frequently, some of them have either blue or green LEDs to make them more dissimilar to a cigarette, or are coloured rather than being the traditional orange and white of a cigarette. And in many ways, it's not actually a response to attempt to make them less like cigarettes, as just an evolution of them as a product in their own right. Because a lot of this is driven by consumer demand. People wanted batteries that lasted longer, cartridges that didn't need filling up so often or replacing so often. And it's very much in response to what consumers have wanted. And increasingly what people want is not something that looks like a cigarette. And the vast majority of the products, either by LED colour, body colour, or sheer size, are now not anything like a cigarette.
Sorry, if I may, in terms of enforcing the smoke-free premises legislation, ASH and the Chartered Institute for Environmental Health issued a statement, I think it was 18 months ago now, about the fact that even where they do look like cigarettes, it's really difficult to understand how any confusion between the two could be sustained, where you have the complete absence of the unpleasant smell of smoke and all the detritus that's left behind after smoking activities taken place. These don't produce cigarette butts. You don't have old papers and wrappers and goodness knows what cluttering up the place. There are obviously concerns around environmental waste. We are talking about electronic waste, electronic products that at the end of life have to become waste electronics, but there are good regulations and rules in place that govern that. But in terms of actual on-the-ground enforcement activity to ensure that the smoke-free premises legislation is enforced, we agree with Ash and the Chartered Institute of Environmental Health that it's very difficult to see how any such confusion could be sustained.
For example, if I lit a cigarette in this room, it would be apparent to everyone that I'd done so. They would be able to smell it. Whereas if I had a puff on an electronic cigarette, no one would know, because the smell just isn't there. The smoke doesn't hang in the air.
Well, there's no smoke, yeah.
So that they are not only visually dissimilar, but the difference between smoke and vapour is also fairly significant. The vapour doesn't hang in the air the same way. It certainly doesn't smell in the same way that smoke does. It's all pervasive. So that there are quite clear differences.
Okay. Before we move on for the second question, you both indicated clearly that you vape. Can I ask whether you both smoked prior to that, and do you still smoke?
No.
No.
Okay, just clarification.
27 years a smoker, 6.5 years a vapor. And I can't go back to smoking because I've got my taste buds back and it tastes revolting.
Okay. And the second question in relation to Ellen is the
Point of sale.
point of sales.
It's a slightly difficult one. I mean, obviously, we would not support any kind of marketing of any form that made the products, was sort of marketed the products directly to children. We would view that as being horrifically inappropriate. By the same token, having them on sale in the same places where tobacco is sold, but more visually, is again another nudge towards people choosing them over cigarettes, potentially. If they're tucked away in the tobacco tobacco cupboard, shut away out of sight, if people don't know to ask for them, they won't. Whereas if they're sort of front and centre and more visually striking than the tobacco displays, which are now hidden away, again, it provides another nudge for people to think, well, maybe I should try one. So we would view the point of sale one as a slightly difficult one, in that, yeah, we don't want any products of these kind marketed to children, but equally they should be aggressively marketed to existing smokers.
On that point, before I bring Gwyn Price to show, unless you want to further on.
Yeah.
There you go first, Colin.
Yeah. Only to say that I find that reasonably unconvincing, because the difference between cigarette tobacco being now hidden behind a some kind of, what do you call it, shutter, that's the word I'm looking for. What seems to me becoming increasingly present, the e-cigarettes on the counter, there's and therefore actively promoted when you're actually paying at a counter, then that's a major difference. And that is, to me, it feels as if they are being actively promoted, if not pushed on consumers. Just in the same way, this is not just e-cigarettes, this is sweets, this is all kinds of different things that are there on the counter, but actively promoted and I suspect paid for in terms of presence on the counter. So I'm not persuaded that e-cigarettes should be there on counters and as prominent, because of course they are, they do contain nicotine, and we've heard evidence in this committee about the health disbenefits of nicotine, and especially nicotine addiction. And one of the concerns that I've had during the evidence taking has been the information that's available to consumers on the nicotine content of e-cigarettes and the various liquids, because the level of intensity of nicotine in many of them can vary significantly, and consumers may not always be straight away aware of that, and could in fact be contributing towards increasing the level of addiction, rather than helping to get to decrease their addiction to nicotine as well as tobacco.
In terms of nicotine labelling, it's actually a requirement that the products are labelled with the amount of nicotine they contain under consumer chemical labelling legislation. And certainly we've always required our members to verify that the product in the bottle matches the label. And increasingly there is reasonably good quality control across the rest of the industry. It's also worth bearing in mind that electronic cigarettes aren't as good as delivering nicotine as tobacco cigarettes. So it's not clear from that whether they can actually increase addiction, although equally by function they are designed to effectively maintain it, just as an alternative delivery method to smoke. But certainly in terms of consumer information, every product should have its nicotine level labelled on it. And if it isn't there, then that's breaking existing legislation.
Okay. Gwyn, do you want to come in this point?
Mr. Chair, can I just raise another point on that? In that one of the biggest concerns that we have is the lack of enforcement of the existing legislation. There is a significant problem with insufficient resourcing and funding of trading standards officers who are there to carry out the enforcement activities. This is a major concern for our members within the industry, and it should be a concern for consumers and indeed this Assembly.
Is there lack of enforcement on the smoking ban?
On everything. But, I mean, on, for example, the consumer
Trading
legislation
standards.
that requires that the labelling matches what's in the bottle. And all of the sort of consumer protection legislation that exists, without enforcement, it's difficult to actually ensure that the standards are there to protect consumers.
Okay.
Thank you.
Gwyn, will you come in this point? And then Dan.
Touching on that with enforcement and enforcement officers, do you agree that it is more difficult, really, when you see a cloud of vaping smoke coming from a distance without the smell, and somebody comes up to the enforcement officer and says they're smoking in a non-smoking area? He goes over and they're vaping, actually. So they have said it's very difficult for them to enforce that, and it'd be even worse if we allow the vaping smoke to go in.
Obviously, from a distance, there is a great deal of visual similarity, although obviously even in a reasonably large indoor space, it would soon become apparent through smell, if nothing else, that it was smoke, not vapour. Outdoors is a little more difficult because although vapour disappears much more quickly, outdoors the smoke tends to as well. Obviously, you can't get much more well ventilated in the outdoors. So the potential does exist in an outdoor space. On the other hand, in an outdoor space, it's difficult to identify anything at a large distance, if you like. And that there are potential there is the potential for places who feel that that's a problem to introduce a voluntary ban. We certainly wouldn't say that people can't introduce a voluntary ban on the use of the products if it suits their own issues and policies. What we would strongly feel is that it's inappropriate to deny those places that don't see that it's an issue to have the choice.
Dan?
Thank you, Chair. And just one brief follow-up to a question that was raised about the appearance of cigarettes. So, would you welcome some regulation which prescribed the appearance of e-cigarettes and their content to make sure that they could not look like a traditional cigarette?
I'm not convinced that's helpful, really, in this context.
Well, if
Because
one of the government's
innovation
aims
and
is that-
development
yeah.
that's happening in the sector anyway
Yeah.
is moving very rapidly away from the form factor, because the form
Yeah.
factor is so limiting in what the performance of the product can do. If you're stuck with the sort of that shape and small size of battery, then it's just not going to last long enough for the
Yeah.
consumer, and there's not enough.
But I think you suggested that about a third of e-cigarettes are still in that
was
older
back then, and I
format.
suspect it's moved a fair way.
But obviously, one of the
since then.
government's aims is to stop normalising smoking, and obviously the appearance of smoking, could potentially continue to normalise it. So, if those sorts of products were regulated in terms of their appearance, they couldn't appear to be like a traditional cigarette. It may help the government to achieve its aims in another way. Do you accept that?
Conceivably.
Yeah, I mean, it's one of those things where clearly there is a market for devices that look like cigarettes because they're still on the market, people still buy them. But whether the kind of utility of that is outweighed by making sure they can't be mistaken for tobacco cigarettes there's a certain logic to that. Because obviously the mechanism of use will always bear a certain visual similarity. But there is no reason really why the devices have to.
Okay.
Can I just follow up on that, though? I would be slightly concerned about the notion of removing the option of a cigarette from smokers. And I speak as someone who I lost my husband to smoking-related cancer at the age of 31. So I'm very aware of the issues on a public health level with this. And my point is this. If a smoker believes that what they want is something that is as much like a cigarette as possible, and if that's the only way that they're going to be able to take that first step into switching away from smoking and into vaping, they may not feel that they can go straight to something like this or something better. They may need the comfort and familiarity of something that looks and feels a lot like a cigarette to begin with. Restricting access to those could have the potential to have detrimental unintended consequences, but on balance, it may be that this Assembly and the Minister decides that actually that's a sensible way forward, and I don't think we would object to it too strongly.
But again, there are ways of doing it without necessarily removing the form factor. I mean, you could specify that they can't be largely white and light up orange.
Okay.
Because something that's a black tube that lights up green is unlikely to be mistaken for a cigarette. So there certainly is the potential there.
Okay, you're the trade industry. The Minister is concerned that that essentially these products can be a gateway into smoking. What evidence is there from your customer base, if you like, of people commencing their addiction to nicotine through e-cigarettes rather than through smoking and coming to e-cigarettes?
Well, the short answer would be that there isn't any. Every time we ask our members or survey their customers or talk to the sort of the vapers we meet in the street, they're all ex-smokers who are somewhat amazed and astounded and hugely pleased that they've been able to get away from smoking, because most of them have been smoking for sort of 20 years or more. Because it does seem to be very sort of an early middle age switch to electronic cigarettes. And I've never, although I have tried to, found someone whose first use of nicotine was an electronic cigarette. Statistically, none of the surveys really turn them up. So yeah, there is effectively no evidence for such a person existing, really. Theoretically, they must. Although, of course, bearing in mind that electronic cigarettes deliver nicotine at a slower rate than tobacco cigarettes and don't have some of the other chemicals in smoke which actually enhance the addictiveness of tobacco cigarettes. It may well be the case that people who start using electronic cigarettes as their first source of nicotine are less likely to get addicted in the first place. So they would become more the equivalent of a social smoker, where they might use the product occasionally, but they're not addicted. Obviously, that's something that we'll learn more about as we get more statistics, because the thing at the moment is the statistics are pretty much dominated by ex-smokers. And the other groups are too small to kind of meaningfully assess. But bearing in mind that what we know about the way they deliver nicotine and the constituents of the vapour, it's not unreasonable to suppose that might be the case.
And what motivates your customers to come through the doors? When they come through the doors for the first time into an e-cigarette store, what brings them in? Do they say? I mean, you're the experts on your customers. Yeah, I'm not talking in terms of the advertising, but they're motivated by what? Presumably, it's they want to reduce harm to themselves from tobacco smoke.
Predominantly, it's people who want to carry on using nicotine, but in a safer way.
Right.
Because obviously there is a huge awareness that smoking is incredibly dangerous, and a lot of people, although they'd like to quit, but they don't really want to. And this is why one of the reasons why relapse rates are so high and a lot of people fail to quit. So electronic cigarettes offer an alternative, but obviously without the smoke. So health is probably the single largest motivator. But there are also people who do it purely on a financial basis.
Okay.
Obviously, it's particularly appealing then to people on lower incomes because the cost saving is huge.
And of course, we generally see an uptick as we approach the autumn and winter season of people who want it for the convenience of not having to go outside into the bad weather with the smokers. You know, so we all see them every year standing out there shivering in the snow trying to have their fix. So that is an incentive. So it's a key driver for many of them, but it comes generally second to the health and the financial implications.
And you've already suggested that around a third of vapers are people who have previously been smokers and have completely quit.
No, much more.
Did you say a third?
That's the statistics as of last time a large survey was done.
Okay, so a third, and then the other 2/3 are either replacing the smoking or reducing the smoking over time.
Can I clarify one point? You said the last time that survey was done. When was that? The last you're using.
The last lifestyle survey was published in, I believe it was May by Ash.
And you've talked of relapse there. Obviously, there are lots of organisations now that have voluntary bans, if you like, on the use of e-cigarettes in their premises. What evidence is there to suggest that people who are e-cigarette users go on to relapse as a result of those voluntary bans?
There isn't really any evidence at all, because what we generally hear from consumers is that they avoid places that don't let them use electronic cigarettes.
So they go elsewhere.
Places that do. So obviously it's not quite so sweeping as a compulsory ban would be.
I mean, that's certainly the case if they can choose a restaurant, but what if their employer has imposed a ban? And they're having to go to the same smoking shed, because presumably they can't just up sticks and go to a different employer, can they?
No, there hasn't really been any great feedback on that I've ever heard. Certainly there have been people who complain bitterly that they've been forced into a smoking area and have to be exposed to second-hand smoke, because obviously once they're a non-smoker, that's as irritating to them as it is to everyone else.
But effectively that's hearsay. So there's no evidence.
There isn't evidence.
I mean, again, there is feedback from consumers on this, and it might benefit the committee to speak to one of the consumer organisations, because they're more likely to be in touch with that than we are.
I mean, how difficult would it be for your organisation or ASH, etc., to undertake surveys of people in those sorts of situations? Is that something you could readily provide information to the committee on, perhaps?
It would be very difficult, because effectively, if you ask for people that's been a problem to you, you've self-selected a sample. Whereas if you select a random group of people, there's a very good chance they won't include any of the people you're interested in. So it would be a very difficult survey to run, unfortunately.
Okay.
Because it would be very useful information to have.
The government's primary concern is children and young people and wanting to reduce the rates of smoking amongst children and young people. We've already talked about the flavours. I mean, how many children and young people, you know, and when I say young people, I mean up to the age of, say, 25, present in your in your sort of shops and stores looking for access to e-cigarettes?
Well, what we hear from retailers who are running those stores and who are forward-facing in the sense that they're directly dealing with the public is that it's extremely rare for minors or anyone that they would want to challenge 25, for example. Many of them are operating that sort of system voluntarily.
Yeah.
And you know, if it's very rare for them to see anybody coming in. I think one of the retailers I was speaking to recently suggested that there might have been one in the past 3 months or something that looked under 18 and was asked for ID and actually was over 18. He was 19. But so it's really, it doesn't seem to be, and I suppose it's very much like what happens with children and smoking. You know, teenagers will experiment with smoking, but they're not going into the shops to buy the cigarettes. They're getting them by other means. And I would expect that where this experimentation at the very low level that the surveys continue to indicate it's happening, the sort of 1 or 2%, maybe 1-ish% of never smokers who are children who are trying it, it's likely that they're not going into the shops to try and get them because it's more sneaky than that. It fits better with the sort of risk-taking behaviour for them to try and get it by other means, in a sense. Do you see what I mean?
Yeah.
But again, it's quite anecdotal. It's difficult to pin it down.
Obviously, children and young people are quite price sensitive, I suppose. Do you think there are other ways of potentially achieving the government's aims of discouraging the use of e-cigarettes by children and young people and the ability to take up a nicotine addiction, perhaps by having a minimum price on e-cigarettes or something of that nature?
It's a very difficult one because most of the products, certainly when you get into the sort of larger stuff, although the ongoing costs are quite cheap, the setup costs are quite expensive. And of course there is the thing that one of the groups with the high smoking rates that the products really need to appeal to are those on low incomes. So there will be a real risk of pricing them out of the market as well. So I think pricing is something where, again, although the intention would be good, the potential for unintended consequences is quite serious.
I mean, what about? I mean, lots of the. What did you call them earlier on? The ones that look like cigarettes.
Cigarettes.
Cigarettes. Some of those I've noticed are disposable, aren't they? I mean, is there an issue there, perhaps that could be addressed?
Certainly they'd be the most affordable ones. But again, they have a very useful niche as a kind of a try before you commit real money for smokers, especially those on low incomes.
Okay.
Because while they're more than willing to set aside the money for their cigarettes or tobacco, spending an equivalent portion of that money on something else would be a huge concern to them. Because obviously if it doesn't work, they then still need to go and buy the cigarettes or tobacco. So, again, the idea in principle makes sense, but the potential for unintended consequences would worry me.
Now, you've mentioned people on low incomes a number of times. I mean, essentially you seem to be making a case that this is having a disproportionate impact on poor people.
In a good way.
I'm not sure if it's disproportionate.
If the government's proposed legislation, that is.
It would.
Potentially, because the thing is, anything that affects availability and price will affect those groups that already have a higher smoking prevalence more. And obviously that does include people on lower incomes generally. So there is the potential for, yes, the proportion, the impact to be disproportionate on that demographic.
On people in, say, Blaen y Gwent.
Alan's got one question. Alan?
Listening to some of the debate this morning, it appears that there seems to be an argument that e-cigarettes are as good for you as an apple. Now, I'm not quite sure I buy that. If the claims that are being made are in any way true or accurate for e-cigarettes, why is it that manufacturers do not seek to have them regulated as a medicine, as a tobacco reduction product?
The problem with medicines regulation is that the products were never really designed to fit within the framework. One of the things they don't really do is they don't deliver a controlled dose per activation. It's down to the user and how they use it, much as it would be with a tobacco cigarette. But the other problem is that most of the sort of mid to high range products, different components come from different manufacturers, and it's broadly impossible to fit that within the medicines licensing regime. So far, the only products that have actually attempted to be licensed as medicines, and bear in mind in some cases it's nearly 5 years since they started down that route, come from companies with multi-million pound budgets. Generally, they're tobacco companies who've also invested in electronic cigarettes that went down the medicinal route, and they still haven't succeeded in getting one through with their budgets. Most of the electronic cigarette industry is made of fairly small companies, and they couldn't even begin to think about the costs involved in that. And the experience of the tobacco company suggests that it wouldn't actually work anyway.
So the reality is then, but you can't actually prove to a regulatory authority that the claims that are being made would actually result in a significant use of these products as nicotine reduction. So whatever, I can understand the economics of some of that, but the reality is, the hard reality is, that within a much stricter regulatory environment, the claims that are made, partly in your evidence but also elsewhere, simply could not be sustained.
I think it's fairly safe to say that a claim that they are significantly safer than smoking would be childishly easy to prove. All of the toxins that are present in cigarette smoke are either completely absent or present at...
But that's not the question I asked you. The question was nicotine reduction.
So you mean use for quitting?
Well, they're not really designed for nicotine reduction. They're designed as an alternative source of nicotine that doesn't expose you to smoke.
It's not a product that is designed in order to reduce nicotine.
No, it's a product that's designed.
So it's a nicotine-based product which is produced for people's enjoyment.
Well, it replaces the nicotine that you'd normally get from smoking. So in a way, it's the same principle as the nicotine replacement therapy medications, but it's in the consumer sphere rather than in the medicinal sphere, both for economic reasons, but also, as PHE identified recently in the Public Health England report, it may be that a certain level of the appeal for smokers of e-cigarettes lies in the fact that they are not medicines any more than tobacco cigarettes are medicines. It's a choice.
I accept that might well be
issue.
the case.
But so in terms of reducing the amount of nicotine, no, that's not what they're designed for. Some people do choose to do that. There are some consumers who switch to vaping away from smoking and then titrate down their nicotine and eventually quit completely, all use of nicotine. But it's very important to distinguish between the need to quit smoking and the need to quit nicotine use.
I accept that.
And of course, they're different.
I accept that, but the point I was making is a somewhat different one.
I'm conscious of the time.
So am I. A lot of the evidence that we've received is that this is a product which is used, as you've just suggested, to reduce nicotine consumption lower. However, you can't actually, none of your products are regulated in that way. And you've said this morning, in answer to my earlier question, that you wouldn't seek that level of regulation. So it is a product that is designed for and manufactured to be a nicotine product designed for people's enjoyment. Yeah. Now, if that's the case, I don't understand your objection to being treated in exactly the same way as tobacco cigarettes, which are also nicotine products designed for people's enjoyment. So if that's the case, then I don't understand your objection to the regulations that the government is introducing, which doesn't seek to ban e-cigarettes, but simply seeks to place them in the same regulatory category as other nicotine products like tobacco cigarettes in the way that's currently regulated in terms of enclosed public areas.
The difference, I would suggest, is very clear that we have two products in the consumer space that deliver nicotine recreationally. One is tobacco cigarettes, which will lead to the death of 1 in 2 users. And the other is electronic cigarettes, which is estimated to be at least 95% safer. So do we treat them as the same product, or do we recognise that one of them has the potential to attract people away from the product that kills people, and therefore make it more accessible and more available. Because what we're saying by treating them the same is, it doesn't matter whether you're using electronic cigarette or whether you're smoking, it's all the same. But clearly that's not the case.
We do have further evidence that we can supply to this committee from a Stop Smoking service in England, who has now a year's worth of data on the work that she's been doing, working with behavioural support to use vaping products alongside the medicinal products.
That would be very
happy to
helpful if
provide
you
that to the
supply the
committee.
committee that information and evidence. I'm conscious of the time. We've overrun our time allocated, but I want Ellen to answer
Yeah, I
your
just
question.
want to follow up then on this issue of, do we treat them the same as cigarettes? And if the committee ends up being persuaded by needing to guard against renormalisation, one way of guarding against that could be banning all public places, but could also be to treat them differently to cigarettes by a more proportionate ban, a different kind of ban. We could, for example, specify on the legislation itself, on the bill itself, that there would be a ban in certain public places. So public buildings, public transport, places that serve alcohol and food or drink and food, may be a more proportionate response to that. Do you have any views on something of that nature, which treats them differently, but also guards against some of the concerns that have been raised by the Minister and in evidence from others?
I think it's fair to say that we don't really view, as an industry, renormalisation as very likely because of the difference between the products, and particularly the difference in exposure to bystanders, both in terms of safety but also in terms of offence. Second-hand smoke is, to most people, quite offensive, whereas second-hand vapour generally is not. And every ban that is enacted of, be it of limited scale or universal scale, will tend to reduce the appeal of the products to smokers. And obviously, to gain the maximum advantage, we want the maximum number of smokers to switch. So everything that reduces the appeal, even a little bit, might potentially have an impact. Because obviously what we'd love for is for everyone to stop smoking and start using an electronic cigarette, and then either go on to quit nicotine or not, depending on how they feel about it. So everything that drives people to switch from one to the other, we think is a good thing. And anything that interferes with that is potentially problematic.
It's also
So the
important to
simple
recognise
answer
the
is
messaging that it sends to the public.
You don't think limited is appropriate either?
Limited is a difficult one in and of itself, because if you take somewhere like a pub, disproportionately pubs are visited by smokers in comparison to non-smokers. So they're an ideal environment to renormalise or to normalise electronic cigarettes at the expense of smoking. They're an ideal venue for that. And peer pressure from people who've already switched can act on people who haven't. Whereas, of course, if it's banned and you're sending the vapors out with the smokers, you can't do that because they're all in the same boat. They're all using their products outdoors as if they're the same. And one of the things that's really driven electronic cigarettes is the fact that committed smokers have started using them and converting their friends. It's not the people who are already, in many cases, inclined to quit. There are people who almost complain that they accidentally quit. Again, anecdotally. But peer pressure can really be a key role in getting people to switch away from smoking. And the pub is the kind of centre of that for a lot of people.
I'm going to stop it there. We've gone beyond our time allocation. Can I thank you very much for your evidence this morning? It's been very helpful. You will receive a copy of the transcript for any factual inaccuracies. If you do identify any, please let the clerks know as soon as possible. So once again, thank you very much for your time.
Thank you.
Thank you.